credits are the only thing making it possible for many Americans to have health insurance today. Without these tax credits, millions of people are not going to be able to afford health insurance next year.
That ain't right.
It's not right. I've already heard. Everywhere I go, because this is my passion. I'm going to tell you.
Yes.
Right.
I made a deathbed promise to my husband.
Yes.
Someday we're going to have health care for every American. And that when you're sick, you can go to the doctor and afford your medicine. And I'm never, ever going to stop fighting for that.
Yes. Right.
But my constituents come up to me and they say, I can't afford health insurance next year. I got one couple that's expecting a baby, and they're excited, but they both have their own businesses, and they can't afford health insurance for all three. So they told me the mom's going to get health coverage with the baby, and the dad said to me, Debbie, I just hope I don't get sick. I can't afford health insurance next year. It is shame. And these are decisions that Americans are being forced to make. I'm getting emails. I got an email from a woman in her 60s who said to me, I just got my premium would be. I hope I don't get sick next year. Otherwise, I'm going to die. Will you come to my funeral?
Sad.
It is sad. In another case, a 63-year-old wrote in saying she's going without covering next year, and she's scared because she can't make it work. And this is on top of the severe Medicaid cuts. I call it the big shitty bill. I'm not in a mood to behave. That passed earlier in the year, forcing an estimated 10 million people off their insurance. And let us be honest. I'm tired of the lies. Medicare and Medicaid do not allow illegal immigrants to get coverage. We are not kicking illegal immigrants off of Medicaid. They don't have coverage. It's our neighbor. It's our friends. We know that uninsured people don't stop getting sick, and they don't stop needing care. They show up in emergency rooms as uninsured patients a lot sicker than they would have been if they had had preventative coverage. And then you know what happens? It leads to higher uncompensated care costs, which gets passed on to everybody, and it's straining hospitals. Some of them are going to close because they can't afford to make it anymore. Between an increase in uncompensated care combined with the significant loss of Medicaid payments, more hospitals are going to be forced to reduce or eliminate services, forego equipment upgrades, or close the door. In Michigan, we have had 10 OBGYN lines closed this year.
Horrible. Horrible.
Shame.
A woman should be able to get health care and have a baby without driving 300 miles, 3 hours. And it's not, here's the reality. Our health care system's already strained. It's at capacity. And we've got to all be concerned about the additional stress. I say this to my colleagues all the time. Even people with insurance have accessibility issues. You know, if you want to go to the dermatologist at University of Michigan, it'll take you a year to get an appointment. I know somebody that has an aneurysm who needs to see a neurologist and could get an appointment at Michigan for 5 months. These are accessibility issues. When you got an aneurysm, you should be able to see the doctor. And just for the record, because of that great shitty bill that passed earlier this year, employer-based premiums are going up. Blue Cross Blue Shield filed 24% increase in Michigan. There are higher numbers in other states. And people in small businesses simply can't afford the insurance.
Disgusting.
It is disgusting. So I'm somebody who believes health care is a basic human right. It's not a privilege for a few who can afford it. In the wealthiest country on the earth, no one should have to decide whether they can go to the doctor or feed their child.
Not one person.
Between taking their medicine or keeping the lights on or putting food on their table. So we're here to make noise across the country. We're going to fight to extend the tax credits,
Yes.
to protect the ACA from Republicans who want to gut it or totally repeal it.
Can grieve.
And we got to keep standing up, making noise, and reminding lawmakers this isn't about a line item on a budget.
Yes, man.
It's people's lives.
lives.
It's real people. Thank you.
That's right.
Thank you. Save the ACA! Save the ACA! Save the ACA!
Save the ACA.
All right. Thank you so much to Congressmember Debbie Dingell, a fierce fighter for health care for all of us from the great state of Michigan. I want to also just introduce myself. My name is Jennifer Flynn Walker, and I'm the co-chief of the Fight Back team at Popular Democracy. We're a network of 47 of the most badass community organizations located all across the country, and we're so proud to stand here with allies from Public Citizen, Public Health Awakened, Protect Our Care, SEIU, People's Action Institute, Economic Security Project, Fair Share America, Faith in Action, T1 International, National Nurses United, Move On, Coalition for Human Needs, Families USA, United for Respect, Network, Be a Hero, and Americans for Tax Fairness.
Yeah.
It's my honor to introduce our next speaker, who can tell us a story about how when you're working for companies, trillion-dollar companies like Amazon, you still are struggling to be able to afford your health care, and particularly with this insane increase to the Affordable Care Act. I'd like to introduce Nancy Regenball, who is on the ACA and who's from United for Respect. Woo!
Yeah. That's it.
Hello, everyone.
Hello.
I'm from Atlanta, Georgia. I gotta say, it's a little cooler up here, y'all. So, as I walked around today in D.C., I kept thinking about MLK Jr. and how he must be thinking.
What the hell?
They're still dealing with health care for all.
Yes.
And then the great John Lewis spirit on the side thinking, yes, but they're up to good trouble.
Yes, that's right.
So I'm here stomping my feet. So I'm going to get y'all, I'm going to bring the heat up from Atlanta, Georgia. While I'm speaking for a couple minutes, I need y'all just stomp your feet. We're going to be stomping our feet.
Yes.
All right? So for the past 7 years, I worked for Amazon. I didn't drive a box truck. I challenged myself. To drive a day cab, hauling a 53-foot trailer behind my back. Yes, I'm a woman.